Dr. Stern, first of all, how are you? Maybe if you want to give a little intro to your background and, maybe what got you involved with Petvivo, that would be great.
Sure. I graduated in 1984 from Davis. I was primarily a horse doctor for 5 years. Then I went back to business school and left veterinary practice entirely for 23 years and did a series of biotech startups in human pharmaceutical industry, including different therapeutic areas and imaging. And when I came back into practice, approximately 2013-14 era, I'm trying to think exactly how Petvivo found me. John, it might have been, you can correct me if I'm wrong, maybe 4 years ago, and said, hey, we have this cool stuff. And I was familiar with polymers and drug delivery from my time at Alza, which was a human drug delivery company. And we'd done a lot of work on various polymer systems for different types of products. So I said, yeah, well, heck, I'll try anything. I'm an old horse doctor. I'll inject stuff into joints. Realizing that now I was doing a completely small animal practice from 2014 on, and that small animal people generally don't inject things into dogs' joints. I did consult for a short period of time for about a year or so for the dog stem cell company, VetStem. And so we were talking about intra-articular injections and so forth of stem cells. And it was sort of in that time frame that someone at the company found me and said, hey, if we send you some samples, would you be willing to try this? And I said, yes, send me some information. So the easiest thing was I was looking at a population of dogs trying to think who could benefit from an intra-articular injection. And it was the ability to sort of avoid surgery in an older dog that had ruptured its cruciate ligament. So I limited my population to a certain subpopulation and figured, well, there really is nothing at all to use on these dogs, so let's try it. And that's kind of where I started. So that's a little bit of an introduction to the
Petvivo connection. So interesting. You're kind of like the first case study, I guess we could say. But I guess go through the process. So John sends you over a couple samples, and then you try it out, I'm assuming, and walk us through kind of what your insight was on the product and on kind of the dog's recovery.
Sure. The first case I did was actually strange because it was outside the population that I thought I would use it in. It was a 1.5-year-old Mastiff, like a 185-pound dog that had some degenerative shoulder issues. And we'd x-rayed it. There was really nothing to do. This dog was just in pain. And so I thought, well, what the heck? I've never, since vet school, injected the shoulder of a dog, but this is a big enough dog, so I should be able to find it. So I actually did an approach using 1 unit of the material, which is pretty low volume. It was about 2 mLs. It was the syringe form at the time. And injected it the next day. The dog was running around the backyard and he was having trouble getting up the day before. And it lasted for months in him. He died for other reasons. He was just kind of a train wreck. But the second dog was really interesting. In fact, it was one of the dogs I'd predicted. An older dog, a rescue lab, probably about 10, 11, 12 years old. There are some written case studies on all of these in the files. And I thought, well, what the heck? They don't want to pay for surgery. These folks, I don't think they didn't even want to pay for x-rays, the lab rescue people. And I said, let's try this in his knee because he can't even walk up and down these stairs and he needs to be able to move to find a home for him. So we sedated him, injected his knee, very straightforward, very easy. And I hadn't really done a knee in a dog since vet school. That's a very easy joint to approach. So I did that, and this dog, like the next day, he was running up and down the stairs and he was nervous about just walking up and down the day before. This dog ended up going to a new home, and the effect was durable for almost 2 years up until he died of other causes. He was a fairly old dog at that time and had other issues. But so that's the basic history. So I've looked for that population of dogs, and I've probably done maybe 8 or 10 dogs along the way. Most of them besides the shoulder and that Mastiff, knee joints, the stifle. And they've all been quite a dramatic effect and very durable. These have all been older dogs, so they do have other issues, but I've tried it with and without oral anti-inflammatories after the injection, and injecting it in different ways, but it always seems to have at least some beneficial effect. if not 100% recovery. I don't have a lot of follow-up. The latest dog I did is a younger dog that actually has an arthritic joint. There's an osteophyte or a bone spur in the joint. It's not really big enough to do surgery. The people don't want to pay for arthroscopic surgery. I just saw this dog like a month ago, and it's out to almost 4 months now. Never missed a step the day after it went home. So I'm starting to expand the use, still staying within that same joint, but for other kind of arthritic changes. But the cool thing about it is, A, it's very simple to inject. It's a very low volume of material. It has great handling characteristics, and there's very little you need to do to prep for it. It's the sterile prep on the skin, a little local anesthetic, and the next day it's like on board. So again, I think it's very easy to use. I did use one competitive product in the world, which is not approved in the US also, but called Arthramid from Denmark and via the UK. A lot of the people in the agility dog world use this stuff. I wasn't happy with the way it handled. The effect was not as durable, but I've had a great success with Kush, and just everything about it. It's easy to use and works. It works.
Yeah, I think you're touching on a great part there. It's easy to use and it works. Kind of walk us through, I guess. Why do you think number one, vets should use it, but also, what do you think is going to make vets using this a little bit easier? What could happen that vets would onboard Kush even faster? What does John and kind of Petvivo need to do to bring Kush to the next level?
Well, again, I'm just I've said this before, so this is nothing new. I think it's hard for people to believe that something actually stays in the joint that long. The thesis is that it's heavily cross-linked or as far as handling characteristics, thick enough so that it doesn't get absorbed easily through the normal vasculature in a joint. Things like hyaluronic acid that are smaller by molecular weight, so size-wise more gelatinous, get absorbed. And same thing in people. They get absorbed reasonably quickly over a period of a month or two. I think what would really bring it home would be some study showing where this stuff actually goes in the joint and how long it hangs out. A video-labeled study where you could just load the joint on day one. You don't have to take it out to 2 years, but just to show that even after a month, there's still some material sitting in the joint. You have to be careful. Of course, radioisotope work is tricky. There may be some other way to do this, but it's hard for people to conceive. And the knee joint of a dog is not huge, but it's not small. It's hard for people to believe, I think, that the 2 cc's or very low volume material actually distributes and stays in the joint like a sort of coating. Like, the paint ads on you guys probably have those on the radio back there, Rhino Shield that, encases your house in plastic paint or something. But, I think that's hard for people to understand. Now, the main procedural thing is that, again, small animal veterinarians are not trained to intra-articular injections. They just aren't. They don't think about doing it very rarely. So, for them, it's like, oh my God. Horse doctors stick anything in a joint, give them a needle, and they'll do it. And for good reason. Horses' joints are larger, they're easy to hit, and it's well proven that there are joints that benefit from steroid injections, PRP, things like that. So they're just you've got a basic sort of fear of doing first one. And then they'll all sort of talk about, evidence-based medicine, we need a clinical trial. And well, that's fine, but, you also have the right to use things off label with informed consent if they help the animal. And people want their animal to be helped. And a lot of people in California doing the surgery, the TPLO, to cure a ruptured cruciate ligament in a dog's knee is approximately $7,500. Not everybody can do that financially. And if your dog's older, you may not want to. It may not be worthwhile. So there's a cost-benefit angle to it as well. So I think doing some simple, limited studies to show what you get functionally. I mean, I see it, and I've got subjective information. I guess I've actually got objective information in individual dogs about what their x-rays look like, what the joint looks like, and how long the stuff lasts. So for me, it's just, that's my proof of principle. But, again, people are going to ask you for more sort of published evidence, which I think is a little bit over the top. I do think showing where it goes. Sorry, didn't mean to interrupt.
No, I'm just saying it sounds interesting. Obviously, it's an interesting angle. You've obviously seen the proof is in the pudding. And for a lot of people, they're looking for all the extra information before they inject someone else's dog. But I think you touched on something interesting, is that as long as people are willing to consent to something like this, hey, a $400, $500 treatment could definitely be a better solution than spending $8,000, like you said. I guess if you wanted to leave it with, what would you say to vets that see dogs or whatever animals all the time that come in with arthritis issues? What would you say to them, and what would kind of be, I guess, your outlook to vets on why they should onboard Kush?
Sure. I would actually focus, I guess, on 3 joints as my primary thought process. The stifle, the knee joint being the biggest one, because you do see arthritic changes. You do see ruptured or strained ligaments. You see a lot of those cases. A lot of them end up going to surgery, many don't, and this is a great alternative for them. I think in the longer term, you might find that it's something, every time you do a knee surgery on a dog, based on whatever it was, if it was traumatic, that's one thing, but if it's conformational, like the way the dog's built, you fix one knee, you know that within the next 4 to 5 years or so, or maybe less, the other one's going to pop. So your larger population over time may be as a preventative in the contralateral leg that you do from the one you do surgery on. I was intrigued because I think the shoulder is actually quite an easy joint to approach, especially if the dog's sedated. It's not an issue. You don't see a lot of shoulder lamenesses, but the surgeons in the specialty practice all have this term they use when they can't figure out a lameness, but the dog has pain in its shoulder. They call it shoulder or even elbows. They call it dysplasia, shoulder dysplasia. That's the big, sort of in my mind, the diagnosis for everything that you really don't know. I would think some of those cases. In general, what we try to do is use anti-inflammatories and Adequan or Legend injections intramuscularly, not in the joint. I would think some of those shoulder dysplasia cases might be appropriate. I've also seen some of those in elbows. And elbows a weird joint. I mean, it's easy to stick needles. There are a couple different joints there, but you see this elbow sort of vague arthritic type of stuff. It's not an easy joint to approach arthroscopically. If there's not a specific lesion or a bone chip, there's nothing to really go in and grab. And I think that might be an appropriate injection site. I would encourage people not to think about the hips. I think there are a lot of surgeons out there, canine people, who do use PRP or platelet-rich plasma to inject in the hip joint. But I think the difference with PRP is it doesn't last as long. It's a short-term sort of Band-Aid. And I'm not sure they really get it in the hip joint, but they get it around the joint. So a lot of the inflammation in dogs with hip dysplasia is around that joint, and the joint may or may not be truly intact. So, but the knee, the stifle, is a perfect one. They're probably, now the statistics probably show there's 300,000 ruptured cruciate ligaments in the US every year. It's the biggest surgery, the largest. You probably have better information than I do, but probably 5 years ago it was at least 200,000. So I think there's an entire industry built up for surgeons in veterinary medicine, canine surgeons with TPLOs and so forth. So again, you got to cut to cure, but there are patients, subgroups, huge subgroups of that 300,000 that are not going to go to surgery. And I think they would benefit by a medical treatment. I'm thinking of, as talking, I don't know about sort of smaller joints in dogs. You get pretty small. And again, I've done mostly dogs in the 60 to 80 pound range. So again, you have to have a certain size, but it's really not a difficult approach to those 3 joints that I mentioned: the shoulder, the knee or stifle, and the elbow.
Awesome. Well, thanks for the insight there. John, is there anything that you want to kind of ask and make sure that people know and kind of get out there?
Well, I want to say we did have some pretty good success with some other vets doing hips. It actually worked quite well. I think we have one or two of those cases written up on our website. But so basically, we have had vets inject for almost any type of articulating spot. We had horse doctor inject the neck of a show horse, and the vet initially thought the horse would never show again because it pops its neck all the time, and it ruptured 3 of the discs. And she injected it into the neck area, and 2 weeks later, the horse was able to show with no issues whatsoever, which was really surprising because we didn't think of it to be able to inject into the neck area because it's more successful if you got more compression on the disc area.
You could probably do a dog under fluoroscopy, but I wouldn't want to inject a spine without some type of imaging assistance. And again, to hit the hip joints, you can do that as an ultrasound guided thing, but that's a fairly special joint to hit. It's not for the average guy to do hips. But if it works in the hips, that'd be great. I'd love to see that done. I mean, it would be fantastic because you don't have much for those dogs that you can really.
Yeah, well, I'll talk to those vets to see if we can get some more detail from them. I know we had a really good success with the German Shepherd hip.
Well, awesome. Oh, I think this was great, hearing the insight, of yourself, Dr. Stern. I think this was great, giving people some insight of what's working for the product and what you're seeing. And I think it's great. Like you said, there's some joints that are easier to hit than others. And it makes sense that, if there's other vets watching this, that maybe you'd be interested in kind of taking a sample and giving it a try. And I think that was great. Anything either of you guys want to say before we wrap things up?
I'm good on our end.
No, I mean, if you need anything else or have any clarifications, let me know. Sometimes I talk too fast. I realize that. I get told that a lot, but I also eat too fast too. But anyway, if you have any clarifications, that would be, I'm happy to do that. But I think it's a great product and it needs to get out there. But I just think, again, I've been always noodling how you get, the last injection I did, we had 2 dogs in one day, and I let the guy that owns the practice do it. And his comment was, wow, that's pretty easy. I'd do that again. And, it's funny, once you try it, it's you say, well, gosh, I could have had a V8, right? So he's interested now. So it's hard to build a big thing by word of mouth, but at least it does start to do that. But again, once you do it, it's like, well, I mean, for God's sake, just find me more cases. I would do more, except, I'm a mobile veterinarian now primarily, and I'm only in the clinic 1 day a week. So those cases I bring down to the clinic. And if I was just in the clinic in a busier situation, I'd probably be doing double the cases. I would not even hesitate to use it in a knee that had some sort of, fuzzy changes. And I'd say, hey, look, this is worth a shot. This is my experience. You tell me. And if it doesn't work, then, we're not out $7,500. The surgery is very successful. That's the problem. You're up against something with a very high success rate, but there's also a subset of dogs where the people, for age, other reasons, are not going to do surgery. And this is the perfect product. And that is a big population in itself.
I think this was great. We'll leave it here. I mean, if there's any questions people have, they can always leave it below, and we'll make sure to get your insight on it. I think that was a fantastic kind of insight, coming from an actual vet themselves. Fantastic. So again, thanks for hopping on, John, you too, and we'll see everyone next week.
Sure.
Yep. Thank you. Bye-bye.